Okay, so let's go ahead and get started. I will also be muting myself in between my questions just so it doesn't mess with the video here. So let's go ahead and start out with stating your name and your title. So let's go ahead and start out with you, Chief Brown.
Hey, my name is Greg Brown. I'm the fire chief of the Eureka Fire Protection District.
Perfect. And can we go ahead and go over to you, Tim?
All right, Tim Bean, Missouri State Fire Marshal, Division of Fire Safety.
Okay, perfect. So I wanted to reach out to the both of you regarding the SB Bill 24 and how it has taken in effect today, and just essentially how did that bill come into play? I understand that Chief Brown was kind of given like the leading on this. So can we
And
speak?
I told you that's kind of crazy.
So what made you want to kind of bring this to light and like attention about like
Well, the Senate Bill 24 came from working with Senator Lincoln Huff about 3 years ago on creating the Missouri Firefighters Critical Illness Pool. And that pool was formed. There's a significant number and types of cancer that firefighters are significantly more prone to than the general public. And what happens, because a lot of these cancers that firefighters are getting are due to prolonged exposures, multiple exposures, and the changing of products of combustion, because of changing in materials that things are made with, houses are made with. And we'd spent several years going to the legislature and trying to give these cancers recognition as a presumptive type of cancer as far as workers' compensation goes, and that just wasn't happening. So we searched for a better way how we could still take care of our firefighters. So we came up with this critical illness pool, and I know you're looking at me like, why is he talking about this? Because Senate Bill 24 deals with behavioral health injuries. Well, we also, our first responders, not just in the state of Missouri, but across the country, there's a significant increase in behavioral health type injuries, PTSD, things of that nature. And we've seen it on a dramatic increase the past 10 years across the country. And certainly Missouri has been no different. So in order to address those issues, because again, a lot of times those come from prolonged and multiple exposures. And a lot of times, talking to some of our partners within the insurance industry who have been working with us on this cancer bill now that we've got that up and running, and they said, a lot of times the insurance industry gets involved on behavioral health issues when it's pretty far down the road and there's somebody in crisis, somebody is potentially going to get hurt or hurt themselves. So we needed to come up with a better way. So the legislation allows us to have the Missouri Firefighters Critical Illness Pool open up to more first responders and address what we need to be doing to change our culture. On the cancer side, there's people can buy in, or agencies can buy in for protection to help with out-of-pocket expenses, unforeseen expenses. But also what we're trying to do there is we're trying to change the culture and do things that are more of a preventative measure, more of an educational measure, early detection methods. So we want to change the culture. And in behavioral health, we want to change the culture as well. There was a recent study done that showed 80% of the firefighters that were questioned on or surveyed on this tool said that they would not seek help for behavioral health issues because they feel like it's a sign of weakness. And that's just wrong. We've got to change that culture, much like we're trying to change the culture around fire service cancers. We want to change the culture around behavioral health injuries. We want to make it that that we're providing best practices, that you know talk about things earlier, bring in critical stress debriefing teams, peer support, and when it gets to a certain level, bring in trained professionals, clinicians, and create a network of the clinicians that are better trained at dealing with first responders. Again, part of our issue that we see is that first responders don't like to reach out for this kind of help because they feel like that's a sign of weakness. Well, that's not the case. We need to be intervening in these things early, helping people get through it, so we don't get to the point where somebody looks at harming themselves or someone else, or ends up out of the career. So that's the goal of what we're putting together, and that's what Senate Bill 24 is doing as far as the critical illness pool. And Senator Huff has been a huge advocate for the first responders in a number of different areas, and he has really helped us out on this.
Yes, I actually was able to get a response from Senator Huff earlier today in regards to it. He had said the need came from folks on the front line, much like the cancer pool bill. This bill expands that same pool to include critical illnesses of cancer and PTSD. The EMS dispatchers and firefighters put themselves on the line for us every day, and this is what we can do to help them and their families.
Yep.
So is there anything else that you want to say in response to that, or just in general at all about the bill?
No, Senator Huff has been a great advocate for us. He's listened to our issues. He's helped us work our way through coming up with an issue that's not only just addressing the issue, but we had issues with the insurance companies on the cancer piece for years, and so we came up with what we think is a better model. Because again, going back to the cancer piece, if we address these things early, we're going to know in 20 years if the program is really successful, because not only are we going to take care of those people who get it, but we're going to decrease the numbers of cancer cases in fire service. Same thing with behavioral health side. If we can do a better job of making it to where people will talk about it, we get them the kind of assistance and help they need, and ingrain and change our culture that we're embracing the idea of working these things out before they manifest into something that's really horrible. So yeah, he's spot on with what he's doing and how he's helping us. He's listened to us on the issues, and has really just been a great advocate for us.
And I also do want to ask about the direct implementation of this. So what would the timeline be? I don't know if Tim, if you want to speak on that by chance, if you would know.
Chief Brown, he chairs the committee that's ramping up this behavior health piece. He was the lead on the cancer pool when it got established in 2 years ago. So, Chief Brown, you probably should maybe elaborate on that better than I can.
Okay. Well, what we have is we've got a steering committee that's been put together of a wide variety of people, from first responders, telecommunicators, EMS personnel, fire personnel, along with clinicians and trainers. And we're building this program now. We're hoping that perhaps the first quarter of next year that we'll be able to roll the program out, because this program, we want to cover everybody across the state. that if they need help, we've got a place for them to go, somebody to call and talk to. We can get people to them. So we're putting together the plan now, and we're building the teams. And from there, like I said, we're hopeful the first quarter of next year to be able to really start the marketing, get everything out there, so everybody knows exactly what you got to do. If you got an issue, here's a place to go.
Is there anything else that you would like to add, Tim, on this? Bill?
Sure. We really appreciate you taking the time and reaching out to us to talk about this important topic in our first responder community. And like Chief Brown alluded to, the trend and the science and has come forward showing this issue across the fire service in general of cancer. So fortunately, Lincoln, Senator Huff was the advocate for that, to get that established 2 years ago, and appropriated the monies, and they voted it into our budget to support that with $5 million. And now the second piece to this, phase 2, is this behavior health, mental, but critical illness piece. And I'm very pleased to see the governor on down, legislative body, to invest in their local first responder, because we're no different technically than an athlete. And an athlete, they cure injuries maybe through their profession, so sometimes they have to get help. And that's what we're finding in our first responder community is, right now today there's an active shooter event I noticed on national TV in North Carolina, and the first responders that rush in when everybody's running away from the event have to deal with the carnage and everything, the stresses that those type of events create. And you compile them over your career, like Chief Brown and I, we're senior people, I guess, kind of, and we've noticed, as time goes along, we probably had issues that we probably should have had some mental counseling or professional counseling on maybe events and situations that we may have dealt with or maybe didn't deal with very well. And we're excited that now we're going to put this tool in the toolbox of our first responders to be able to reach out. If you have a catastrophic call and you're laying maybe back in the firehouse and it's 2 a.m. in the morning and you just can't seem to get your arms around the why, and maybe it wasn't the best outcome or something, hopefully what's going to be created is you'll have that lifeline to call somebody and speak to them at any time, day or night. And I think they're looking at possibly having an app that you can log on to and things of that nature to get some immediate help and to help process these events. And so I'm very excited as a state fire marshal to see the support that we received from our governor on down to invest in our local responders during these events we find ourselves in.
Thank you so much. And is there anything else that I didn't ask you or that we didn't touch on regarding SB 24? I also see that there's peer support counseling programs that will be pushing in some new provisions, it says here. And I don't know if there's anything else you want to speak on that or anything else at all.
One thing that caught my attention with the legislation that I really appreciate, and they're kind of a hidden gem as far as the continuity of our first responder community, is the telecommunicators that were added in this. And the folks at these dispatch center and communication centers. They're taking the initial call and then they're dispatching, and they have people on the line, and the conversations they find themselves in. It's very critical, and the things they hear and the help they try to give somebody through the phone, they're really the hidden gem behind the motion. So I was very pleased to see personally them being added into the critical illness legislation.
And any last regards for you, Chief Brown, at all?
No, I think we hit everything that I can think of. Appreciate your time.
Well, thank you so much. I thank you guys so much for taking time out of your day to meet with me. I know it was kind of quick, but I really appreciate it. And I hope you guys have a great day.
Yep,
All
you
right,
too.
Chief,
Take
thank
care.
you. Yeah, reach out anytime. We appreciate
Perfect. Will do.
See you later, Mr. Fire Marshal.
you. See you, Chief Brown. Love you, brother.
Love you too, man.